welcome everyone. And Zelda and I would love to, instead of doing this on a virtual format, we would love to be sitting around a kitchen table with you
Mm.
and talking with you and hearing about your personal experiences. When Carissa asked me about doing a webinar addressing caregiver grief for people working in care environments, I thought, okay, who is the best person we could have other than you people who are doing the work? Who would be the best person? And across the country, I heard Zelda's name a number of times. So thank you, Zelda, for being here and um,
Well, thank you for inviting me. I'm
with
very
us.
privileged to be here with you today and with all of you that are in the room with us.
So Zelda, this incredible work of caregiving, and I think I'm going to just read a couple sentences to get us started. So, so in long-term care, in home and community care, relationships with the people we care for often grow, sometimes quietly and often deeply. And as a result, as providers, we may experience grief when the people we care for are transferred or die. And the grief we experience may feel invisible and sometimes may be unacknowledged. So today we want to give space to explore, think about the losses, to explore the grief, and provide some practical strategies for coping with that grief. And and I hope that we'll have a bit of a unique take on it and the process that we talk about, how we talk about it. And we'll provide a few great websites at the end for you to check out. But Zelda, talk to us first about your involvement in care environments and what you're seeing and what you're hearing.
Sure. Thanks, Kath. My involvement in care environments, I've worked in both home care and across different care networks. Also did a little bit of work in research. So what we hear and what we're seeing, especially in caregiving, is that healthcare assistants, personal support workers are part of the care providers. And a lot of times, the grief that they may experience, the grief and loss that they experience in their workplace, is not always acknowledged. In fact, it remains quite invisible. And when that happens, we know that it can accumulate in terms of losses. It can affect the person's well being, their mental and physical health, and that we now know a little bit more about grief. Grief needs to be in the forefront, and it has become a little bit further in the forefront. And no, we now need to start acknowledging how to best support people in the workplace when it comes to experiences of grief and loss in their workplace.
So sometimes you hear people say to us as hospice palliative care nurses and social workers, etc., you hear people often respond saying, oh, that's difficult work. And how do you do that? And what can I do to support you? And da 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 da. And oh, you're angels, just like they did right at the beginning of COVID, not so much at the end.
Mm.
But that acknowledgement that it's hard. Um, but often working in long-term care, people don't realize that in fact you are doing the work that hospice and palliative care are trying to do, but in fact most times with fewer resources. So a
Mm.
few years ago somebody told me their sister worked in a palliative care unit and in the city she lived in, and I thought that city doesn't have a palliative care unit, it doesn't have a palliative care program. And so when I met the sister, I said, so tell me where you work. And she said, oh, I work in a long-term care home. And I was so delighted that this person had identified, I work with people who are dying. Yes, I work with people who are living. Yes, sometimes people come into care and they get stronger. But yes, I work with people 100%, unless they're transferred out for some reason, 100% of our clients, our residents will die. That is my work. And and acknowledging that, in what way, Zelda, does just even acknowledging that to ourselves, to the community, in what way is that
Mm.
helpful then?
I mean, I think the person that you spoke to has already started, like they're already on the path to looking at how to integrate palliative care principles into long-term care, and is really bringing those two worlds together, the restorative, the rehabilitation world, and the world of palliative care, which is really focused on, a good quality of life up until death, and what does that look like for different individuals because everyone's unique. And so there is a bit of more identification and acknowledgement in the long-term care world, the facilities that there is death that occurs here, and that the majority of the care that's provided in the residence are provided by the whole team, but a lot of it is provided by the healthcare assistants, and they have connections with those people that have been there, that remain there for a long time. So we know that it's going to happen. What we're not doing so well is acknowledging that we need to be equipped, we need to be trained, we need to be supported in the care that we give, knowing that people are in an advanced care state of illness, and that they may need extra support from those that are around them and helping them.
So
Um,
after the
mm,
crisis of COVID, when government tuned into the difficulties happening in long-term care. In Ontario, they brought in an act, they call it the Fixing Long-Term Care Act, which I kind of thought was, oh, kind of
mm,
hurt a little bit for those people who'd been, working their butts off and their hearts out for years, to have it sound like we have to fix you, and also sounding like they just weren't being acknowledged for what they had been doing. Anyway, but
mm,
within Fixing Long-Term Care Act, there is a mandate to integrate a palliative approach and in long-term care. And that same call is happening without the act, without the legal stuff, but it is
mm,
happening across Canada and really around the world in terms of looking at how can we integrate palliative care earlier for people with any life-limiting illness and across all care settings. So here we're talking about grief.
mhm.
Why does this matter early? How does this integrating this? Why would we be talking about this in a thing on grief, Zelda?
Well, I mean, it's to me, it's quite obvious that we're talking about grief within this context, because what you just mentioned before, Kath, right? That working in long-term care and living in long-term care, caring for people with advanced illness, we people are dying in long-term care, and that's why we're talking about palliative care and integrating palliative care, because palliative care is focused on the care of those that have advanced illness and will die eventually. So that's we need to talk about bringing that care and principles of that care of palliative care, which includes grief and loss. So if we're working with people that are dying or living until they die, uh, w- grief and loss is part of that. And it's a very important part of palliative care, is to acknowledge that those that are caring for those with advanced illness, the residents of the long-term care centers, will experience and do experience, to varying degrees, grief and loss. You're caring for individuals in a lot of times in a very intimate and personal kind of way. You're getting to know the people that you're caring for. You're trying to, in some ways, bring them as much comfort as you can. And it's difficult to see people that are in discomfort. And so all of this weighs on those that are providing care. And not acknowledging that grief and not acknowledging that it's part of the care that we provide, um, can have a very negative impact on those that are providing care. So it's really bringing into the forefront that we provide care to people, and because we provide care to people, we may experience, to varying degrees, grief and loss of those individuals that we've been caring for. And I think that's why we need to talk about grief in this context, right?
I
Um,
also think about the whole thing about, as a hospice nurse, when people say, "Oh, that must be hard." Well, people are coming to us to die. So if we can make their life and their living more full, then that to me is my job, and that makes me feel better when I say goodbye. And then I say, I'd have rather loved and lost than never loved at all.
mhm,
But So when I think about integrating a palliative approach, and I think sometimes if we only look at rehab, if we only look at restoring, if we only look at feeding, and if we only look at dying, if we only talk about dying, if we only talk about goals of care and what you want in the last days and hours when you're dying, then we're missing things. But if we pull them both together, then I think we have a healthier balance, which I think is healthier for us as caregivers, and I think we provide better care. So I just want to go to one of the things that often is the biggest challenge for people, and that is decreased appetite and involuntary weight loss.
Mhm.
And and if we wait to talk about that when it happens, then often the team is in an uproar. They might be mad at each other about how people are or are not handling it. The family may be upset with the staff. The staff may be upset with the family. But if we in fact have done those conversations and set that pace earlier, then hopefully as decreased appetite occurs and as involuntary weight loss occurs, and as the person becomes less able to swallow and unable to swallow, then I think we are better able to walk people along there. And then again, that to me affects my grief following.
Absolutely. The more that we integrate or bring those two approaches together, like you mentioned, most people live within that realm, though. They live in the middle, right? Like rehabilitation is one end, and end of life care is the other extreme. But most people that live in long-term care live in that middle area where they may be functioning quite well, they're maintaining their level of autonomy, but then there's some deterioration, something else might happen, and so we have to be skilled and able to care for them within that sort of middle area, that area of life that is life, right? So we're not only talking about a death and dying, we're talking about maintaining good quality of life, and having that communication with people about what's important to them. So one of the things that we can do, and we is communication, is also talking about how to have those conversations with families and with the residents about how they may foresee some of the things that might happen in the future, so that we know the person better, and then we're much better able to answer and make sure that we're responding to what their values and beliefs might be. And then that also helps us in our grief process as well, that we feel that we've done good by them. We've provided them with the care that they defined as being important to them. And that in itself will help the care providers, the healthcare assistants, the whole team feel like they've done something good for the people that they're caring for.
Sometimes when we talk about palliative care experts coming into long-term care, I think sometimes people working in long-term care or working with seniors must kind of roll their eyes and go, like, because these people are experts in dementia care. These people are experts in this long-term commitment. And we are newcomers. But when I was originally asked years ago to do a course on dying with dementia, and I'm going, I don't know if the dementia care world's ready for this. I don't know if you're ready for this. I don't know if the palliative care world's ready for this. When I started doing the research, in fact, the research was there and it wasn't new.
Mm.
It showed from decade before, it showed that pain management helped to decrease good pain management in properly used could help to decrease confusion.
Hmm.
That people with dementia also needed to have pain managed, etc. Right? So that research was there. And then the other thing that was so amazing to me is um, how the dementia care world, the gerontology world, the principles and the practices dovetail so beautifully. And I love that. But one of the things that I think we bring is the ability to have those difficult conversations. And and hence, one of the things that I think when we're integrating a palliative approach and we are doing that as a team, but when we're struggling to call in the palliative care consultants and don't walk out when you call them in to have the conversations,
Hmm.
participate with them, and everyone get better about having those conversations. Someone said, well, it's not up to the volunteer to prognosticate, it's not up to the HCA to prognosticate. No, but the volunteer might be the one that says your mom can't stand up today, and the healthcare assistant might be the one to say to the nurse, so and so is no longer able to stand. She's not safe to transfer.
Mm-hmm.
And those, all of, we're all in here together. One of the stories I love about a healthcare assistant, I guess it was a personal support worker, actually, it's an Ontario story, was a personal support worker getting an award from, I think it was the Ontario Long-Term Care Association. And the story that went with it was that a woman with dementia, her husband had just died and she needed to be informed. And so, informally, the team came together and they informally asked this support worker if she could be the one because she was the one with the relationship. And then from there, they coached her on, what she might say, how she might do it, da 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 da. And I love that as an example of team. So, so this piece about having the better care that we can provide,
Mm-hmm.
and and for us, that importance of integrating a palliative approach before death. Let's talk about, sorry, the better care we can provide earlier does affect our grief following. Let's
Mm-hmm.
then talk about time of death following death and what things one might do to help in our grieving.
Yeah, I think there's a couple of things that we can actually do. One of the things that we can do is be a little bit flexible with time. You know, and some of the things that I was reading, I realized that flexibility in time is a really important element to allow just a little bit of time for those that are providing care. To the person who requires a little bit more care, perhaps at towards the end of life, that the healthcare assistant, that this is acknowledged, and that the healthcare assistant might have a little bit, a few more minutes to be able to spend time with that person, whether it is just to sit with them or sometimes it's to be with the family as well. And so flexibility of time is an important element, as care may require a little bit more time. And I think what I've also read is that healthcare assistants are concerned also about the person dying alone. And so they're, going in and checking on the person, and reassuring each other. I went to check on her. She's doing okay. Or if you have a few minutes, maybe you can pass by. So sort of working again as a team, and that the communication is circulating within that team. But we also have to be careful that we don't leave healthcare assistants to carry all of that on their own. Families come in, families are distressed, especially towards the end of life. Healthcare assistants are the ones that are going into the rooms more often, providing that care. And so they're also supporting family caregivers, family members, friends that are coming in to visit. And so we have to acknowledge that extra care that they're providing to others as well, and that how that could impact them if things are not going well, if there's discomfort, if there's a lot of distress. We have to be able to communicate that to the rest of the team so that the team is also supporting that family and not only leaving the healthcare assistant to do it on their own, because that will impact them during that time. So that's another really important element as well, is making sure that we're acknowledging the extra that they might be doing, not only for the resident but also for the families, and supporting them in that. How are you doing with that? How could we as team members support you if you're the key person, and this is important to you? Or how do we come in maybe and also do the same, help families, maybe bring them aside, see how they're doing, by other team members that it may be available to provide that kind of support as well. So I think that's another really important thing that could impact
So,
our grief.
so you have talked about a couple things. One, you mentioned having the staff having time alone with the person or being able to say goodbye. You've also
Hmm.
mentioned the support for family and for the support worker not to feel like they're in that alone. And if there are difficult and tricky situations, this is a great time to also for the um, social worker to be called in.
Oh,
In fact, it's nice to call the social worker in even when it's not difficult. The more we have the opportunity to work with one another and to model for one another and to see how different people respond and different things work and different people, how they are with families,
hmm
different things work for different people. Sometimes sometimes people will do a debrief following a death,
hmm
and that can be a really helpful way too, especially if things have been difficult. But if things have gone well, what things went well? Let's identify what did we do so well? What went well here that the death felt like a good death and it felt good considering who the person was. It felt good for the family. It felt good for us. So what went well? Oh, okay. Those are good things to then hold and remember.
hmm
What things didn't go well, or what things do we perceive didn't go well? And how might we do that different in the future? And to
hmm
be able to hold that and give that space. I think that's another one that can affect us in terms of our grief moving forward. What's your thoughts there?
Yeah, I completely agree with you, Kath. I think we have to create the space to talk about and discuss our experience, especially, but like you said, things can that go well. It's really important to discuss that. It builds also team and builds trust within the team. So, we were able to support and bring comfort to this person, and I think it's important to acknowledge that together as a team, and also talk about, like you said, what didn't go well, what could we do differently next time. If there was an uncomfortable death, for instance, it's important to talk about that, because if we don't talk about that in our workplace where it happens, we may be left very isolated as a healthcare provider on our own to deal with those potentially emotional, laborious type of feelings, and that could feel very isolating, and that could turn into, more difficulty. It could turn into perhaps disengagement, where people say, "Well, I've just had too many deaths on my floor. I've given everything I've got. I'm on my own," and we don't want to create that kind of feeling of feeling isolated within
Mhm.
an environment that is actually a team, right? There's people around the other residents as well, right? We want to be able to also show the other residents that we care about people that are dying in our residence. We're all concerned and we're all involved, and that we also want to reach out to the other residents while this is going on to say, "Are you okay?" Making sure that they are not left out, because by leaving them out, that could make them feel again also themselves isolated. So we definitely want to create some space to say, "Hey, are you okay? How did this go for you? How are you living with this what's happened?" And giving some space to talk about it as a team is a really important part of validating that experience and bringing grief into the workplace in a positive way.
So Jillian has mentioned that her team does palliative rounds once a month and acknowledges each person that has been lost or that has died I guess, that month. I wonder if we just take a minute for anyone else, if you just put in a short clip here, if you want to, of something that you do. Sometimes people will put a butterfly up on a door when someone is actively dying or has died. Um, Sometimes people will put a quilt on the body as the body
hmm
is being removed, and people will stand aside in like an honor guard to see the person off. So if anybody wants to add that in. So we've talked a bit about before death and time of death. Danielle says the special candle for
hmm
the day after the person has died, sometimes putting a name with that. Um, So we set a memorial table in the entryway with a photo of the resident and a short write-up. How lovely, Eva. A
hmm
quilt and honor guard, then we can their disc picture can go up at the front desk with a piece of paper that staff and others write their favorite memory. How lovely, because then you can write your memory and then that could go to the family after.
Hmm.
Mary says we have a dignity quilt. You know, it's funny because sometimes, people have been used to seeing the bodies go out at night out through the back door instead of out through the front door. A white dove on the door and a house quilt. Comfort groups for the other residents. Lovely.
That's lovely.
We have a dove on the door, a room for family to decompress and stay.
Hmm.
A staff putting a lily on the individual that has died. Support group for
Yes,
residents
that's
after
good.
someone's died. That's lovely.
Hmm.
And our
That is.
residents leave through the front door the same way they came in.
Hmm.
I remember a couple, some old vets that used to get to know each other through a respite time. They all came in at the same time, and then one time, one of the residents or one of the old vets died, and staff were kind of worried about this. And you think, if anybody knows about death, it's the old veterans, right? Anyway, so instead
Yeah.
of closing doors and shuffling the person out through this facility, they brought him out through the front door, and the other old vet just stood up and saluted him, and it was very, very touching. Okay, let's just have a look at this last two. Bodies brought to the morgue shrouded by
Mm.
a Canada flag. Moment of respect with our staff meeting at the front entrance to see the
Hmm.
family and resident off. We have a white rose on the door, a comfort cart, debriefing space. Curious about rituals that we have for honoring the deceased. How can we begin to develop a model of grief literacy for workers, providing staff with knowledge that equips them? Crystal Jade, this is a very good question. Providing staff with knowledge that equips them and identifying their own grief. So let's move now. I want to just mention, and we'll move to follow larger pieces of grief here. But I think about if we aren't conscious, if we aren't doing the things that Zelda's mentioned, then it's like you can put a sweater on and kind of comfort yourself with a sweater, and then another death happens, and another sweater, and another sweater, and another sweater, and another sweater, until you're walking around carrying this sweater or this burden, and realizing that you're just not even aware of what you're carrying.
Yeah.
So we've talked a little bit about pre-death and about embracing death in a way that helps us provide um, excellent living and dying, hopefully through to death. The importance of developing those palliative care skills for communicating about tough stuff and developing the ability to call in the palliative consult teams when needed. And then we talked about time of death and following death. Let's talk about more general in our lives, um, and and how do we carry this, and what are the things that are helpful, Zelda?
Yeah. Well, I think one of the things that are helpful, we sort of touched on already, is the integrating a palliative care approach, uh, planning in advance as much as we can, um, acknowledging that grief and loss that comes with working in these environments and with individuals. Um, the talking about advanced care planning with families, and working as a team, uh, bringing grief and loss into the conversation, I think are all and bringing in compassion, right? Like knowing what we do in long-term care requires a certain amount of the use of self, the use of compassion, um, and that we want to encourage that, but not burden the healthcare providers either with feeling that they have to be compassionate for everybody and every situation, because that's not necessarily realistic, right? Uh, we are unique as individuals. We bring who we are to our workplace, but at the same time, we also have things going on in our life. We also may have had experiences that may make us approach things differently than others, and we also have to acknowledge that. So, allowing for space, allowing for individual reactions. We're not going to have the same reactions from everyone, but acknowledging that I think is really important as a way to incorporate that into the workplace. There's different ways of doing that. One way is working with, uh, you know, like one of the participants mentioned, groups for the residents after the person dies. A gathering of the residents. I mean, memorials, as someone else mentioned, making those, regular. Um, not brushing death away, but actually acknowledging that these people were important to us. They were important, and that we want to acknowledge that they spent time here with us, and that they've moved on, and we wanted to say goodbye. So I think it's a really way of making it part of and normalizing the grief that could exist in long-term care.
So you've talked about normalizing, and in many ways, that's one of the pieces of grief literacy. And somebody has asked about specifically about that, and I'm thinking we've got only too short time. I think we should just stay till midnight tonight, don't you think?
I think so. We have so much to say.
Must be something about self-care in there. What I hear you talking about there is also setting limits and identifying that we all have different triggers and the ability to say, I cannot care for her again in another day. I need a week off. Give me a different assignment. Give me a
Hmm.
different unit. And those things, having that flexibility. I always laugh that as a mother of five, the F word is my favorite word, the F word being flexibility. We have to build into our system some flexibility. But let's talk. So grief literacy, one of the excellent resources that's come out, a couple in the last few years. One is Grief Canada Grief Alliance.
Hmm.
Another one is Grief Matters. And both of those are good resources and good to think about. Now, one of the things I want to comment up on is that sometimes we've spent a lot of time talking about self-care, self-care, self-care,
Hmm.
and resilience. And people, I think, in workplace are going, don't talk to me about resilience anymore because you're saying that I need to do better self-care so I can be more resilient, so I can come and do 20 hours of work in 8 hours and leave feeling happy about it. So I
Mm.
know that there's negatives to all of these words, but all the research that's been done about self-care and go for walks and do this and do that, and yet, one of the things that is showing up as being most important is connecting with colleagues.
Yes. Yes. That's definitely a very important. We saw that the importance of that post-pandemic, right? Where and that connection is a
Mm.
really important element of just like the building blocks of good care, right? And also like to our protection, we have to also have some protective factors, and that is an important element too, is that we can rely on each other. That we're working on we're working together. It's an us and not just me kind of thing. I think that's a really key to taking care of ourselves. I think another important key is also to educate ourselves. Like you mentioned, a couple of really good resources. I'll plug in my other resource, which is the Caregiver Grief Connection, and reaching out and talking about grief. And there's resources, these resources are amazing in terms of looking at, well, what does grief mean? And how will I feel? And how do I react to grief? And what does it mean to me? And how do I live that grief? People who have not maybe experienced or had a lot of experience in that area may not know that having a migraine every day before going to work might be a reaction to, or having an upset stomach, not feeling well physically could be a reaction to their grief of having lost maybe several people on their floor, one after the other. And then all of a sudden, they're really not feeling well. They're physically tired. And we don't always associate that with a possible grief reaction. So, knowing more about how I react to grief, how does it impact me, makes me better equipped to see those signs, be aware of them, and then do something about them. Whether it's taking a few days off, whether it's, going for long walks in the evening when I have some time, or doing other important things that bring me joy, because we've got to balance out joy and laughter with some of the more sadder parts of our lives, which could be where what we experience in our workplace. And so I think that's part of it. Self-care, yes, we could say, as you mentioned, do this or do that. It's really up to the person what's important for them to know what brings them joy. It could be music. It could be a number of different things, and it's hard to just sort of say, well, what could it be for you or me? We need to really think about that for ourselves. Spending time with the people we love is a great way to do self care. Attending a course on mindfulness is another way. And what might work for you may not work for me, but we need to really know what's important to us
It's
in that
funny,
area.
for me, one
Yeah.
of my favorite self-care modalities is education. I love learning something and coming away inspired by that. I want to share something we started here about 15 years ago in Victoria, and that was celebrating the hearts and hands of healthcare workers. And after about six of those different one year, the first year we did it twice because we did it in the spring and then found out there was an annual celebration day that was announced for that October, I think. So then we did it twice that year. And then we did it after that. And then Safe Care BC came in and picked that up. And it went from being a place where we got together for a couple hours in the afternoon. There was free food, there were gifts, there was massage tables set up, there was all sorts of fun things, and we celebrated. And our goal was to celebrate and give thanks for the incredible work being done. Now Safe Care BC has taken over. They have three different conferences each year in the fall, and this year it will be in Nanaimo, Langley, and Kelowna. And it's so exciting. The first year it was 35 bucks, full day education, big breakfast, big lunch, snacks, the cheapest education you could find. I think it's gone up in price. Food has gone up in price.
Mm.
But I am so excited to be part of that. This year I get to be there for the Nanaimo one. Um, but I am so proud of this organization for doing it both to celebrate as well as to provide education.
I think and re-energize, right? So we get a
Yeah,
lot of we feed off of each other, right, in terms of that positive energy. So it sounds like an event that will also re-energize people. I can imagine we'll leave feeling just a little bit lighter and just a little bit, maybe a little bit with a little bit more energy. And I think that's really a really positive. It sounds like an amazing event, and I'd like to hear more about it and maybe bring
and
it out east.
what, yeah, yeah, yeah. And one of the things I think that's really important there too is connecting and taking home some names and phone numbers. Sometimes we need to talk to someone who's outside our system and debrief and have someone who shares a love for the work, shares a knowledge of the work, but where we can talk confidentially, but we can talk and brainstorm together. So I hope if anyone's going that they'll take home some names with them.
Mhm.
Now, there are some comments here, including that Crystal Jade has a paper about communal approaches to grief.
Mm.
And so, Crystal Jade, I'm sure that Carissa would love to know more about that when that's published. And Zelda and I would absolutely love to. Now,
Mm.
I'm just looking here. Vanessa had said, could we please repeat the grief resources? Yes, Canada Grief Alliance and Grief Matters. And Zelda,
The,
your
yeah, the caregiver grief connection.
caregiver grief connection. Could you type that in,
Sure.
Zelda? And uh, home
Yep.
3 years for the pandemic leaves one feeling forgotten, a whole other kind of grief. And Shannon, just unfortunately too true for too many people. Um, and Rebecca has written caregivergrief.com.
Yeah, Rebecca's on our, she's one of the members of my team. Hi, Rebecca. Thanks for putting that in. She's really quick with putting, I was just about typing it in and I saw that she was there doing it for me. So that Caregiver Grief Connection is what Rebecca has put into the chat.
And another one is the virtual hospice. And I think
Mm,
that they're about one of my favorite. Of course, Life and Death Matters is a favorite for me, but the virtual hospice and has a number of different resources, including some cultural
mhm,
pieces and including kids and grief. And yeah, and if anyone's looking specifically for stuff around kids and grief, thanks, Carissa, for putting those in.
mhm,
Andrea Warnick and her group offer some excellent education and certification. We have a staff member who is trained as a death doula. Do any other long-term care homes also have a certified death doula and could share their approach to utilizing their skills? That's an excellent question. So, Allison Cascanet, if you want to if anybody wants to connect with Allison, I don't know how you can share emails or whatever, but that would be a great way to
yeah.
reach out. Judy is saying, I'd love to know more about Self Care Day being held in Nanaimo, and Carissa will give you that. I would love to help with this if you could use some volunteers. Okay, so and Allison has given her email. So I'm just wondering, when somebody comes to something on grief and they probably want to, are thinking that maybe we were going to do a PowerPoint and a list of things that one could do. And we decided not to do that. We decided to do this as a podcast instead. Are there any questions that anybody has? Otherwise, we'll do some other more concrete thinking about to share. So if first of all, if you have any questions specifically you want to ask, please put that. The chat seems to be working well. And Rebecca has put in some links.
Mhm,
Um, I'm thinking, Zelda, that when we think about grief, I love the idea that grief is a healthy, whole person response by which we adapt to loss. Um, Marnie Thompson pointed out it's not always healthy, depending on how we do it and what's happening,
mhm, mhm,
but it is the whole person. So when I think then of self care or think of how do we cope with grief, I think, okay, then I have to look at my whole person.
mhm,
So what can I do for about my feelings? How can I address feelings? How can I address my mental functioning or lack of if I'm having a hard time just thinking clearly? What can I do about my body if my body's feeling lethargic? What can I do about my relationships if I'm fine like feel like I'm cutting off relationships? So I think that when we look at a self-care plan, we need to look at that whole person. And I think we also need to have a crisis self-care plan. So when something goes terribly wrong, or we just have hit a wall, what can we do in that crisis situation? So
yeah.
what are your thoughts?
Well, I think it's really important that if you're hitting a crisis situation, that you reach out for help. And depending on where you are, will depend on what help is available, right? So, for instance, there's employment assistance programs. I'm not sure if that's what they're called in BC, but some workplaces will have a certain number of sessions available to employees with regards to dealing with number of different issues, and this would be one of them. So to reach out to whatever you may have available through your workplace, that could be offered to you, for free or reduced cost. Reaching out to local organizations and associations that may have some programming that's available to you as well. Perhaps some support groups, perhaps just being able to talk to someone on a helpline, for instance, could be very useful. Um, we could go as far as we said, those debriefing sessions also could be very helpful as well. And all of the other activities and events that we may do around, improving grief literacy in workplaces could also diminish the feelings of isolation and crises after the fact. So it's recognizing, okay, what are our signs for ourselves, and then reaching out for help and support with regards to that. So if it's gone to a point where, for instance, we're disengaging from work, or we're disengaging from our personal life, our relationships, that's when those are, for me, would be red flags to say, I've got to do something about this. I've got to either speak to somebody or participate in some kind of an activity that will bring me some kind of relief from what I may be feeling. So, for instance, the Canadian the Canadian Center for Caregiving Excellence, which is an organization that's national, they have a mindfulness group for care providers, and that's free. It's free number of sessions. They're actually starting their next group on October 9th. I just looked at their website prior to coming into the today, and that's available. So it might be, or maybe that might be something I need to practice. It may be something that could help me, be more grounded, be more mindful of my own feelings and presence and what's going on around me. So that could be something that could be very helpful to people, and they can use those techniques and skills in when they're feeling that they need to focus in on being grounded, and just breathing techniques. A lot of people say, oh, breathing, we all breathe. Yes, we all breathe every day, every moment. But there are some techniques with regards to deep breathing and breathing in presence that could bring a release of anxiety, of not feeling well. So that is another way also that could be very helpful. For some people, it might be joining a walking group. But we have to differentiate between, coping with grief and loss in the workplace and our own personal lives. That is our way of coping, and then we have to acknowledge when it is beyond those ways of coping, and when we feel that we're overcome with grief, and then we need maybe to reach out to more specialized or concentrated types of supports that could help us with that particular area. So we have to be able to understand and be aware of that for ourselves.
So, Zelda, Shannon's mentioned about complex bereavement and clients. And are you aware of any resources in particular?
For complex
Yeah.
grief, I would reach out to, like I said, I think like the Victoria Hospice, if you happen to be in Victoria Society, sorry, that could be a resource. I know that they offer counseling and support group services. I don't know if they do it virtually, but I mean, I'm just so across the country, there are probably different types of organizations and support programs that could help deal with complex grief.
So, we've just got a few minutes left. And if you can, just while I'm asking this question, if you could look at Shannon's question, does McGill offer any continuing ed on grief and bereavement, or seminar or course or conference format? Um,
Yeah, sorry.
Now, I'm just thinking one thing is we've got the Canadian Hospice Palliative Care Association conference coming up in Nanaimo um, next month, and there will be some good pieces on grief and bereavement in there.
Mm-hmm,
Um, and Victoria Hospice does, if you're living on South Island, provide
mm-hmm,
some good supports. Um, One thing when both Carissa talked and Zelda talked about the employee assistance type programs, and in addition to the employee assistance program with your facility or wherever you're working. Safe Care BC, I assume that's in addition or separate, is offering counseling as well. Um, and sometimes I think also there's a hesitancy, like who am I going to get? And
Mm.
will it be any good? And I almost think that you need to go and hunt for those in advance. You need to put that on your list to make some appointments with the employee assistance program, filter through until you find somebody that you feel is a good fit. And then when you need, you have someone there that you can use.
Mhm.
And to me, that is perhaps, I think that is an extremely important thing for all of us to do, to have somebody in our pocket that we can call on.
Absolutely. And with regards to any programming at McGill, the Caregiver Grief Connection, actually one of our goals is to provide more education and training for healthcare professionals around grief literacy, around grief in the workplace, and etc. So definitely reach out to us. Our website will have our email. You can contact us by email, and we will be happy to connect you with any resources that we know that exist across Canada. So feel free to give us a call or like I said, email us, and we'll do our best to support you with any kind of resources that we know exist across the country or are specific to a particular area. But like you said, the Canadian Hospice is a wonderful resource. They have a lot of
Virtual
educational,
hospice.
Canadian Virtual Hospice. They have a lot of wonderful resources, a lot of educational, self-directed educational models as well that could also be helpful to individuals.
The Canada Grief Alliance, they have put together some really good one-page,
Mhm.
very easy visual formats. And somebody has asked, how do we let our people know when we've had a grief at work? And I think I'd approach Canada Grief Alliance and say, that would be a really good thing for you to develop because one, I can take your different posters and put them up at home and start to educate my people. But that would be a really interesting thing if we had a way to let people know. In the days when wearing black let you know that you were a widow, or wearing a black ribbon or something. And I wonder if there wouldn't be an education piece that could
Mhm.
let someone know as well. Something that maybe as a society we should pick up because um, our populations are such that we're only going to be seeing more deaths per year. And as a society, we need to come together and identify when we're hurting. Wouldn't it be wonderful if there was a way that you walked into a coffee shop and they knew you were
Mm.
a caregiver and today was a day for a free cup of coffee?
That would be amazing.
Now, Shannon put something in very first that I didn't get to comment on. Importance that we, excuse me, that to remember that as clinicians, we have been through this hundreds, thousands of times.
Mhm.
And for persons and families, this is their first time. And I think that in a way that is a message of uh, um, a message of empathy, a message of compassion that just they're new to this, and
Mhm.
and give them the grace. And we may not be new to this, but give one another the grace. Dr. Wilfeld has pins, apparently, he gives to his clients to indicate there's been a death in the family. And, maybe we need a pin to say, hey, work is tough. And we've just had some losses that cut me to the core. And having said that, I want to finish with what I said earlier, which is I'd have rather loved and lost than never loved at all. Zelda, I've loved the work that I've done, and I've loved the people I've met, and I hope that I've provided good care, and I hope that um, I have all those hopes for the work that I've done. And I'd rather do this work than anything else. Do not ask me to assemble widgets. do not ask me to do code work. Let me carry on doing this work and let me be healthy doing it.
Exactly.
And I think one of the reasons I do the teaching and the writing and that we have Life and Death Matters is specifically because I want to make meaning and of the grief that I've seen and want to decrease some of the suffering.
Well, you said it all, Kath. I appreciate you wrapped it up, and I feel exactly like you do. So that's a wonderful way to end today.
Thank you. Thank you everyone for being here. Zelda, thank you for coming
Oh, thank you
and
for having me.
for the fun of working together.